spot them and what to do with regards to treatment as well as prevention. I'm Dr. Freddy Gomez and you're watching MedTalk Health Talk on CNN Philippines. We're here to build a healthier future for you. Now, allergic rhinitis is triggered by allergens, and allergens can be found in so many things: pollen, mold, cockroaches, insects, particles or flakes from skin from certain animals. That's why it's very important for any individual to understand what causes this, what triggers this condition. Now let's welcome our guests. Joining us is Dr. Maria Lourdes Enicilia. She's an ENT head and neck surgeon from Medical Center Taguig and St. Luke's Medical Center. Also with us is Dr. Fatima Joanna Santos Ocampo. She's a pediatric and adult allergist from the Asian Hospital and Medical Center. Now, for those with allergic rhinitis, the symptoms may be similar to other allergic reactions. I'll start first with Dr. Mari. Can we discuss what some of the common symptoms of someone who has allergic rhinitis are?
So with allergic rhinitis, rhinitis meaning nasal symptoms. So the usual nasal symptoms would be sneezing, and it's usually violent, like sunod-sunod na pagbahing. So several sneezes, one after the other. And you usually have watery nasal discharge, so yung matubig na sipon, hindi siya malapot, hindi siya makulay, it's usually very clear, and then nasal blockage. And sometimes the nose is very itchy, even the eyes. And for children, sometimes they cough also. And very classic with this, if you're talking about allergic rhinitis, is there's no fever.
Whenever they find these types of symptoms, what should they think about, Dr. Mari? Should they start thinking first that this is a viral type of illness, or is it more common that this could be an allergic type of reaction?
Well, for most of the patients with allergic rhinitis, you might have noticed already happening even when you were very young.
Mm-hmm.
So you sort of recognize it already. And again, if there's no fever or you're feeling na magkakasakit, like your body pains, joint pains, then you would think more it's allergic rhinitis. And again, if there's a pattern, and then it will just go away. But if it's the symptoms are lasting the whole day, several days, and the mucus is becoming thick, and you feel bad or there's fever, then it might already be like a viral cold or even a bacterial nasal problem. So then you might need to consult your doctor.
When it comes to other related factors that could increase the chance of someone having allergic rhinitis, what could some of the more common things be, Dr. Mari?
If your parents, you have relatives, your siblings also have allergic rhinitis, you're more at risk for this. But it's also environmental that they found over the years. There's also what we call a hygiene hypothesis. So they found that those who actually were exposed to a lot of different infections, were playing outside when they were kids, they tended to have a better immune condition, and they did not have the allergic rhinitis. They did not develop it, unlike those who weren't really exposed during childhood. So that's what. And also your exposure to pollution, actually diesel fumes, they found that this can actually make you develop allergic rhinitis. So that's also a factor.
Now, Dr. Fatima, when it comes to this, yung environment natin, air pollution is increasing, the smoke is increasing from vehicles, lalo na dito sa Metro Manila. Are these surefire triggers, especially for someone who has allergic rhinitis?
Actually, it's a global thing. No, it's this pollution that's over the years now coming from fossil fuels and all that has actually created, of course, what we all know as climate change. And what does it mean? Actually, that means that there is a real elevation. One of the things that's concerning is that the temperature, the environmental temperature has actually increased. No? These are irritants. They're not really allergens, but they're irritants. They really affect the functioning of our airway. They make them very responsive, yung umiipit, ganyan, kaya nagkakaroon tayo ng asthma attacks, no? And the same thing happens in the upper airway. It affects the lining of the upper airways, masyadong nai-irritate. Kaya yes, you'll have more of the sneezing, the runny nose, at saka yung congestion.
Now, I'd like to ask Dr. Mari, right now, papunta na tayo sa Burr months. Marami tayong mga changes in temperature, changes in weather. I'm sure a lot of our viewers do feel some of the symptoms coming from that. Nasal congestion, some irritation. Is this allergic rhinitis? How can we explain this better to our viewers?
So at this time of the year, with more moisture in the air, you can have more of the mold, more of the dust mites, and with wind, air current, sometimes the pollen, there's more pollen coming down or going around you. So yes, most patients will have more severe symptoms this time of year.
Now, Dr. Joni, what are some of the complications naman that can arise with allergic rhinitis that isn't identified or isn't managed effectively?
People with allergic rhinitis tend have more chances also to have asthma, by the way, allergic asthma. So I hope people would realize na if your allergic rhinitis is not controlled, it can actually trigger your asthma. So when you have asthma, you have to bear in mind na baka meron akong allergic rhinitis na hindi na-address.
Okay.
So that's very important. Ha? And then also other things, for example, yung pagkakaroon ng sinusitis, no? This is an inflammation of the lining of the sinuses, no? Dito sa loob ng upper airways, sa kaloob-looban. So you can have that. And that could really be very bad, more severe yung mga symptoms mo. And you can also have parang bacteria added to it. So you can have an infectious rhinitis, sinusitis tuloy, no?
Meron bang certain levels ang allergic rhinitis when it comes to its severity? Meaning, are there people who have allergic rhinitis pero tinitiis lang nila kasi nakakayanan naman nila? What can you say about people who are not getting treatment even in the mild forms?
You can have complications pag pinabayaan. So how do you know if you need to see a doctor? I usually say if you're having your symptoms every day or almost every day, like 4 times a week, and it's every week, and it lasts more than 1 hour. Now it's half the morning or even the whole day, and you can't even go out without having a handkerchief or your tissue paper, and you can't play sports, you can't sleep well. So even though natitiis nyo po yun, kung ganun yung effect sa inyo, then it's something that needs to be controlled, and you have to see a doctor to avoid the complications.
Up next, we'll talk more about the causes of allergic rhinitis and how you can control or prevent them. We're your connection to healthcare. You're watching MedTalk Health Talk on CNN Philippines. External factors can cause your allergies, and these allergens or irritants can vary from pollution to dust to pollen, among other things. Now we'll go more in depth with the allergens that can be found inside your home and how you can control and prevent any symptoms of allergic rhinitis. I'm Dr. Freddy Gomez, and you're watching MedTalk Health Talk on CNN Philippines. We're together in health. Now, some plants make a fine particle called pollen that's light enough to travel through the air. And this is how these plants grow and reproduce. But inhaling this can be a trigger to an allergic reaction, especially in a tropical country like ours, where plant life is very abundant, even indoors. Now, Dr. Joni, how can pollen, specific pollen, actually be a trigger for allergic rhinitis?
Pollens come from plants, so weeds or grasses, mga trees, no? But they differ in character, in size, no? So in general, what we think of as allergenic are the ones that are very light, very tiny, no? Such that they can float. They can be carried by the wind, actually up to 400 miles, no? Depende sa wind, no? And of course, they can also enter our system better. So nakakapasok, nalalanghap mo siya. So those are usually the pollens that are responsible for our allergies.
Dr. Mari, can you give us some tips on how to keep our homes pollen-free, or for that matter, if I have a pollen allergy, what is the best thing for me to do?
If you've noticed that with your indoor plants, you're having more attacks, so maybe you need to change the plants that you have. Again, not every plant is allergenic. It's usually the ones that shed, a very small seeds or light flowering plants. Actually, we've seen less allergy for a lot of patients because they've been staying indoors, and when they go outdoors, they wear a mask. So that's actually one protection if you're particularly allergic to pollen, especially when it's very windy or there's thunderstorms, high wind rates. You would expect more pollen in the air. So actually using our masks have protected us.
Dr. Mari, when it comes to this, dust mites, these are very small bugs in someone's house. It can't be seen by the naked eye, but it can cause an allergic reaction for people. Is there anything that you could suggest for our viewers to potentially identify if they do have a dust mite allergy? Are there specific symptoms that they could watch out for, certain scenarios?
Dust mites are your most common allergens and very classic upon waking. When you wake up, you haven't even stood up, you haven't gone anywhere, you're sneezing, you have runny nose, you have nasal blockage. Most likely you're allergic to dust mites because the dust mites are in your mattress and pillows. And if you live in the Philippines, most likely you have dust mites in your mattress and pillows. That's accepted because they like the humid environment. So if you want to protect yourself from dust mites, there are dust mite covers. But remember, again, there's a limitation to their efficacy. Over time, it's not as effective, so you might need to change. And then they are killed by heat. So you just need to wash your beddings in warm water regularly. But even the mattress and pillows, ideally you expose them to direct sunlight or heat so that you can also kill the dust mites that are there.
Dr. Joni, can I ask you naman, meron bang difference ang dust mites and bed bugs? Because a lot of our viewers might confuse the two.
Bed bugs are larger than dust mites, no? Bed bugs you can actually see, no, easily. Dust mites are microscopic. For you to really see them, you really need a microscope, no, to see these creatures. They really like to go where the people lie down, they sleep, no? Similarly, the bed bugs also would like to go there. But then the bed bugs also would like to stay in your mga damit, yung mga seams ng mga folds sa mga damit, no? Yung mga ganyan sa materials. Then, you can maybe see them. The bed bugs will not cause allergic rhinitis. However, there are people who can be sensitive to bed bugs, mind you, pero sa kagat nila, no? Tsaka it's the skin, no? So you would see a pattern of rash na pwede mo sabihin, ay, yan, bed bug yan.
Dr. Mari, let's talk about molds. A lot of people may discount this, don't really think about this as something really dangerous, but they can lead to some really serious complications with someone's body.
We're very lucky in the Philippines. We have a lot of mold and dust mites. So they love the humid environment that we have. So we have to find ways also to limit our exposure to the mold because they really cause a lot of allergies. You have to remove any damp areas in your bathroom. You clean, you wipe down. Make sure there's the curtains, they tend to develop mold, damp clothes inside the closet. So you have to minimize these damp areas and decrease the humidity to less than 50% to lessen both the dust mites and the mold.
Dr. Joni, let's talk about pets. And are pets really the cause of a lot of allergic symptoms? How can true pet lovers deal with this? What can they do?
Well, as with any allergy, this is genetically determined. No? First, you have the predisposition nasa genes natin. A lot of times, no, I'd say 75% of the time. Now, ibig sabihin, may tendency ka na, so baka hindi mo maiwasan yon dahil meron yung nanay at tatay mo no, na ipasa sa'yo. So, however, may mga studies rin naman that show that there are some parang tendencies na baka less ang expression ng allergy na yon kapag na-expose ka early in life. Now, if you have an allergy, established allergy already, so ang key pa rin natin is to prevent exposure. So, kung talagang hindi mo mailalayo or hindi mo pamimigay yung pet dog or cat, siguro at the very least, nasa iba silang room or outdoors kung pwede ang sitwasyon. No?
Now, this time of year, allergic rhinitis is so common. When we return, we'll talk about how to treat allergic rhinitis. Your health is our mission. This is MedTalk Health Talk on CNN Philippines. There are several ways to treat allergic rhinitis, and these include trigger avoidance, even medication, as well as even home remedies. I'm Dr. Freddy Gomez, and you're watching MedTalk Health Talk on CNN Philippines, where your care always comes first. Treatment for allergic rhinitis depends on how severe your symptoms are and how much they're affecting your day-to-day activities. Dr. Mari, what are some of the more common medications available to treat or control allergic rhinitis?
From vitamins, supplements, to the over-the-counter anti-allergy medications, or what we know as the antihistamines. The decongestant, usually what you take for flu, which can help you also if you're very congested. But, I have nothing against this if you want to try it once in a while for your allergic rhinitis. But if you find that you're using it all the time, then maybe this is not the right medication for you. There are other medications that your doctor can give if you have symptoms all the time. It's not good to take these over-the-counter medications every day for a month, 2 months, a year. So you have to see your doctor already.
Now, Dr. Joni, when it comes to treatment, is it okay to try over-the-counter medications to control my allergic rhinitis? If my friend or my neighbor takes this medication for their allergic rhinitis, it may work for me as well. What's your advice on this?
Depends on what it is, no? Kasi when we say over-the-counter, honestly,
RPN, Radio Philippines Network Incorporated, DXPO.